For those of you who are tuning in live, as you know, you've got the opportunity on the chat to put a question in, and we'll have time after each speaker concludes their remarks for questions. I know we've got a couple already, and if you'd be kind enough to mute your microphones until you're introduced. I want to thank the Eloy Chamber Board of Directors for suggesting that we provide our membership with this COVID update, and the Eloy Chamber is fortunate to have tonight's co-host, Richard Rosales, to monitor the internet connection and assist with the entire technical production. I've got real low, I live out in the country and I have real low internet speed, and nobody will give me anything else, unless I go online with a satellite. But anyway, we're going to get started, and Katie Boddy, the floor is yours.
All right, thank you. Good evening, everyone. My name is Katie Boddy, and I am the Center Director for the Central Arizona College Small Business Development Center. And our center is one that's part of a larger network of small business development centers, but we specifically serve people in Pinal County. And the majority of what we do is offer one-on-one counseling services and training courses to small business owners in the county. All of that is done free of charge to the small business owner. We're a grant-funded organization, so we don't charge for anything that we provide. And we meet with businesses who are in all different stages, whether you're starting up, growing, looking to sell, and in all different industries as well. Excuse me. You name it, we've met with a business in that industry. And specifically related to COVID, obviously we continue our one-on-one counseling services. The conversations are just a little bit different this year than they were last year. Our training courses, we've got several targeted specifically towards crisis management, rebuilding your business, those types of topics this year. Everything that we provide is on our website, which is cac.sbdc.net. That's where you can go to request counseling or see what trainings we have coming up. And we are a direct partner with the SBA, so we have lots and lots of information on all the disaster loan options, whether you haven't applied for one yet or you have, and now you're looking at what those forgiveness options might be. We are here to assist with all things disaster loan related as well. So that's just a little bit about the SBDC, who we are and what we do. Thank you for having me here tonight.
Thank you, Katie. I think we lost Mark for a second, but I'll come in and I'll introduce Isabel Morales. She's a board member and with Great Western Bank. Isabel?
Hi, thank you. My name is Isabel Morales. I'm a business banker with Great Western Bank. I've been there for 19 years. And before I came to the bank, I was an agriculture lender. Great Western Bank started in 1935 in South Dakota. We're still headquartered in South Dakota. The bank's mission statement, our mission is to make life great by taking outstanding care of our customers and creating long-term relationships, and especially taking care of customers during COVID-19. All banks are in the same mode. We are in the identify, assist, and monitor mode. If you don't bank with Great Western Bank and you're a small business and you need assistance, please reach out to your lender or call myself. We are a preferred SBA lender, piggybacking on Katie's presentation, which means we operate with delegated authority from the SBA, and we make decisions with that delegated authority, so we don't have to go through the SBA for approval. We're a regional bank, but we have local decision making, so you're not going to have to drive to Mesa or the Valley to meet with a banker. Again, we're in the identify, assist, and monitor mode. And so if you need any of those services, please feel free to contact me. My office is in Casa Grande. I also service Eloy, Coolidge, Maricopa, and Globe. Thank you.
Thanks, Isabel. Next would be Jill Broussard.
Hi, good evening. My name is Jill Broussard. I'm the Pinal County School Superintendent, and the Pinal County School Superintendent's Office offers services to the 19 districts within Pinal County. So we assist with grants and payroll, printing checks, data processing, professional development for all of the districts and teachers, as well as education in the juvenile detention facility and in the jail facility. We also have an accommodation district, Mary C. O'Brien, and that includes Mary C. O'Brien Elementary School just outside of Casa Grande, and Villa Oasis right there in by Toltec. And throughout this COVID process or situation, continuing for services starts, and we've pulled in county health, county emergency, and because there's a lot of for Tascha ambiguity in some of the direction that we've gotten, but also there's just a lot of questions from our superintendents, from our teachers, from our parents and students. So continuing to offer those support services and identify needs and locate resources for our districts. And I can continue with questions on down the road, but that's an overview. Thanks.
Thank you, Jill. Dr. Spears?
Thanks. Thank you so much. Good evening to everyone. Thank you for having Pinal County Public Health as part of your panel. My name is Tascha Spears, and I was appointed to the position of Public Health Director on July 1st, kind of at the height of the pandemic, but definitely part of a very hardworking, dynamic Pinal County Public Health team. I know we're here probably to focus largely on COVID, but just to give you an idea, Pinal County Public Health District does still provide 8 divisions of program and services, including environmental health, 11 clinics, school and health liaisons. We have our Zika mosquito lab. We still provide services related to other infectious diseases such as tuberculosis, sexually transmitted infections. We also oversee vital records, vital statistics. And so we do continue to offer all of those services. With regard to COVID-19, Pinal County did see, just give you a little recap, Pinal County's first documented positive case of COVID-19 was during the week of February 23rd to the 29th. And there was a slight increase in cases as the months went on, and then a tremendous acceleration in cases that began towards the end of June. So we saw a huge spike in cases with close to 200 cases a day, with the highest number of cases occurring on July 8th, and that was 309 cases that day, and several hundred other cases as we continued through the month of July. We started to see a slight downward trend, thank goodness, towards the end of July. And then we saw a spike 3 times in August, and that was August 7th, August 16th, and August 23rd. Now, for those of you who have been following the public health website, Pinal County Public Health website, it has been our assessment that those spikes in August were relative to inmate testing, inmate and detainee, and jail individuals, incarcerated persons tested through the month of August. That testing started August and ends September 3rd. When you see confirmed cases on the ADHS website or the Pinal County website, those are documented on the days that the tests are actually collected. And so we have worked very hard to pull out specific addresses to try to separate out those spikes in test results. As you're all aware, ADHS has put forth guidelines based on 3 measurements of surveillance in communities. And basically those measures in surveillance conform to the CDC standards. So basically the benchmarks for businesses and schools are dependent on 3 kind of surveillance measures. The first being how many cases per 100,000 in any given community. The second surveillance measure is the percent positivity of diagnostic tests. So those would be tests that reflect active infections, not serology, which is looking at if you ever had the illness. And then the third surveillance measure is the number of admissions to hospitals with what's called COVID-like illness. Now, the state has taken out influenza-like illness and focused on COVID-like illness. So those are the 3 surveillance measures that basically are behind the benchmarks that ADHS has put out, the state has put out for schools with regard to the type of education, whether it's on-site hybrid learning or strictly virtual, as well as the reopening guidelines for businesses. So that's kind of an overview of where we are. With regard to the current stats, those are on the Pinal County Public Health website. We update those. And then every Thursday, the state updates the benchmarks. And those have to do with the business and the school benchmarks. We have been working with the school superintendents at the bequest of Jill, who has brought in public health to work with school superintendents to offer information on other factors that might be affecting different communities. So for example, if we look at Eloy and the surrounding communities in Eloy, and we look at zip code data specifically for Eloy, we are able to see a high percentage of positive test rates that pertain to corrections. And so that kind of information is shared with the school superintendents. Certainly we have, with regard to the business benchmarks, there are executive orders specific to those. And so the ability to offer other guidance relative to the business benchmarks is limited. So we appreciate the ability to work with community partners. Clearly, those of you in rural communities are very well aware that many factors affect COVID, and education is huge in terms of informing communities of how the virus is spread, as well as prevention measures. And we know in the Eloy area, we have a high percentage of Spanish-speaking persons and families that are extended families that live together. So there are factors that affect community spread and transmission, and it's only through these community partnerships and community efforts that we will be able to really tackle this pandemic together. So I know that was a long spiel, but I'm not sure if I hit on the kinds of information you would like.
I feel like we
think
covered
it was
some of the
excellent.
things I wanted to. Thanks.
But and you'll have an opportunity to come back, because I know we have at least 3 questions already.
Okay.
So we'll come back and do those questions. We'll try and go in the order that we started with. And that takes us to Mr. Hill from the Rose Law Group.
All right, well, good evening. My name is Eric Hill, and I'm an attorney with Rose Law Group. And I guess I can just tell you a little bit about sort of what we're doing for business clients as they've been facing the coronavirus and sort of dealing with all of the different complications that's involved. I think there's really kind of sort of 3 key aspects of this that businesses have been struggling with. And initially it was it's kind of a funding and having difficulties understanding like the federal aid that was out there, and then sort of some of the operational changes that businesses have had to undergo subsequent to COVID. And then finally, we get questions about sort of liability related issues. Initially, most of what we were dealing with was clients who were trying to understand some of the different sort of loan products and federal aid. 2 of the panelists I know are affiliated with SBA lenders, and so certainly the Paycheck Protection Program was sort of the primary vehicle for getting funding out to businesses that were in need when the lockdowns were going on during March and into the spring. So we dealt with that quite a bit, and we helped quite a few clients sort of navigate all of the funding options that were out there. And we're sort of anticipating that if there's a second round of stimulus that's been discussed, the Paycheck Protection Program could have a second part to it, and we'll certainly be prepared to help clients navigate that if that comes to fruition. But more recently, what we've seen is that a lot of clients are really struggling with sort of the operational aspect of this, and that is that now that they're getting back and people are going back to work and people are starting to come to their businesses, it's like, well, what does the new normal look like? And what do we do to change our business, the way that we operate in light of COVID? And I'm actually also affiliated with a company called Healthy Verify, and what Healthy Verify does is help businesses take on that issue. So, say for example, you're a business owner, you're opening your, say retail store, for example, and you're saying to yourself, well, gee, I'm inundated with all this guidance from the CDC, from, all these different sources that are telling me, what I need to be aware of in protecting my employees and my customers. And what Healthy Verify does is we come in and we work with a board certified immunologist from the Barrows Institute. She's our medical director, and we sort of help businesses put together a plan that will mitigate risk and that will help them minimize the risk of an infection developing in their business operations or on their business premises. And so we've worked with a really wide range of companies developing those plans. We've worked with school districts. We've worked with events venues. There's been really a lot of interest in that as we've sort of reopened over the last couple of months. And then finally, like I say, the issue would be liability, and that's something that is a question that a lot of businesses have. Is like, okay, well, how do we think about liability? Is there exposure to liability for us as we reopen? Are we reopening too soon? Are we reopening in a way that's responsible and so forth? And what's our exposure to liability there? So those are sort of the 3 kind of, I guess, buckets I'd describe of issues that we've seen businesses dealing with in response to COVID.
Eric, thank you. I'm going to take the first question and give it to you, Eric, since you're right there. But before I do that, Katie, are you still able to? Are you still there, Katie? I only got 5 people on my screen.
Yes, I am.
All right. Do you still have a few minutes, or?
Yes. Yeah.
Okay. All right, Eric. We're gonna go back to the specific question, and this is the question: if a business that has been forced to remain closed ends up totally closing as a result, are they able to sue the governor?
Right. Okay. So I guess my answer to that would be, I mean, yes, you can sue. I mean, anyone can sue anybody. I don't know as far as suing the governor specifically. My suspicion is that there would be some qualified immunity issues relating to him specifically. But I think more broadly, yes, you could sue the state for the impact to your business when there's the closure like this. The problem, though, is that the standard for evaluating a closure and a government action in this case would be it's what's called the rational basis test. And so the government just needs to be able to articulate a rational basis for its closure. And that's sort of the issue that we've seen with the distinctions between bars and restaurants being barred from opening, sort of different businesses that hold different types of liquor licenses, for example. And I mean, there's a case right now that's you have a bunch of bars that are suing the state over that issue. And so thus far, the courts have held that there is a rational basis for the closure, and the bars have not been victorious. I know that they're going to appeal that, but for the time being, they have not been successful.
Could I tag on to that? Do you have maybe perhaps not that you have a crystal ball, because obviously nobody knows what's actually happening right now, but in this venue, do you have a feel for where the bars are going to get, I don't know how to phrase it properly, but maybe the opportunity to compete with those restaurants that have bars? I use Chili's as an example, not to pick on them, but their bar is separate from their restaurant, and they're open in both cases. Their bar is following the same rules that everybody else has, 50 or 60% capacity maximum, 6 feet away. And of course, you know, this question is on the basis of the bars that say, hey, wait a minute, just because I don't serve food, I'm out of business and I'm paying taxes and so forth. So this long question just says, do you have a feel for a time frame of when the governor may say, all right, I put out the word that said, you know, your number of COVID-related patient positive people, the percentage is close enough. And I guess what I'm really saying is, just to throw a date out there, do you think that things will possibly change in 60 days?
Well, yeah, I mean, I guess I'd be happy to speculate. Don't hold me to it.
Yeah, absolutely.
But yeah, I think, yes, I guess my suspicion would be, I mean, particularly because of, you know, where we are as far as the number of cases. And I mean, just looking at the benchmarks in general and the improvement in the benchmarks that we've been seeing, I mean, I know, and probably all of our panelists are watching those benchmarks as they come out every Thursday. But yeah, my suspicion would be that yeah, within 60 days, if we hold to the pattern that we're seeing, that we would see that.
Well said, and thank you very much. It took too long to ask that question. All righty, we're gonna take the next question over to Joe Broussard. And that particular question references schools starting. And the question starts with this. It is reported that schools in Europe have been back for some time, what is different from their situation, that is France, Germany, Spain, that enables them to be in a school that's open, where the U.S. is so reluctant to open?
That's a good question. I'm not sure I can answer all of that. I think Dr. Spears might be able to give us some insight into that. But I do know that there were several countries that were able to go back successfully, and then there were several countries that had some issues and had to reclose again. So I'm not really sure what would be different. I know that we are, just trying to learn from the countries that did it successfully, and we're modeling after them as far as, social distancing and masks and cleaning, and I think just not wanting to make the same mistakes. But a lot of those recommendations are, again, given to us educators by the state health department and in the executive orders from the governor. So we are taking those recommendations and putting those in place. And I kind of want to mention one thing here. There was an op-ed written by Superintendent Greg Wyman a few weeks ago, and one of the things that he said that just, I knew, but just hearing it out loud really helped solidify that this is a really divisive topic as far as like when and will kids go back to school. And I think that when we say divisive, a lot of times we have some divisive topics that are maybe 80% feel this way and 20% feel that way. And really, when we have sent surveys out, and in each district really has sent several surveys out this year, just trying to gauge where the parents are and what their plans are for the future. But we have 50% feeling one way and 50% feeling the exact opposite way. So no matter what decision we make, we're in a tough spot, because we're going to have, it really is going to cause divisiveness. And that's unfortunate, because we really want to show our generation, tomorrow's generation, how to successfully deal with something like this. And unfortunately, we're just showing them a lot of divisiveness. And, it's the nature of this situation we're in. And I think all that we can do as educators is try to see both sides of the argument, and try not to find a compromise that's going to make 100% of the population upset with you because you compromised. But it is really a tough area. So I don't know if Dr. Spears, if you can add anything as far as the differences between the countries.
Well, I'm not sure if you can hear me. Yes? Okay. So I think there possibly may be a number of considerations with regard to, it's not really a reluctance, but maybe a delayed reopening in the US. And again, I'm speculating as well. So please consider that. So we know that Denmark opened very early on, and then in May, France opened, and within a matter of days, there were about 70 positive cases within days in May when France reopened many of their schools. And so looking at those lessons, some of the factors that became critical with regard to determining safe reopening had to do with very clearly looking at community spread. So with the US, we saw our waves sometime later. And with community spread, there is a concern about children and staff coming in and out. And then in the course of what we learned about the virus, we learned that you could be asymptomatic, not show symptoms really, or have very few like pre-symptomatic, and still be infectious. And so one of the considerations for reopening was in a lot of the op-eds and a lot of other literature, it was suggested that you have to have very robust, very extensive testing available in your communities to be able to really determine what your spread looks like, and also then determine your confirmed cases, those cases that we're testing that may have been negative, to be able to get a good sense of that. So I know that, that those factors were important. The lessons learned in Europe had to do with the schools that opened really early on, took a look and found that, you know, limited class size, but very importantly, staggering when students come was critical. That seems to be one of the main factors for, at least one of the main factors for successful reopening, is staggering the times that students come and limiting those sizes, as well as the distancing, the hygiene, masks. Many of the successful schools had outdoor lessons that were going on. So you had space outside and you had outdoor lessons. Some places that still used library books had quarantining of library books for 3 days or longer. That was in the UK. So there were all these kind of lessons that came to the forefront. But really community spread is really critical, and that's why it's part of what's being examined is your positive active infection rate. Pinal County moved forward on trying to obtain funds to get as much testing available. So on Monday, we added 2 test sites, one in Casa Grande and one in Florence. Free testing for anyone who wants testing, no questions asked, no paperwork, no insurance, nothing. If you want to test, you can go have a test. And I think those are the kinds of pieces that need to be in place. And then we're going to, we can see as well, like Mr. Hill suggested, we're moving in the right direction. So a lot of different factors. Just one other factor I think that limited maybe the US moving forward in some jurisdictions, and that was like in May, June, where there were starting to be identified cases of multi-system inflammatory disease with children. And so all of a sudden that became known, and that although it's a very rare condition, it was identified in children about 2 to 4 weeks after they had tested positive for COVID. So that kind of put the brakes on in some places. And again, a very small number of cases, very limited, very rare, but it was identified. And so the other part of that is pediatric testing of children was a little bit, there was a lag in that. And so now as we start to have more testing of pediatrics and that population, you know, they're also being included in that larger examination of test results as well. So just a whole number of things I think came into play.
Thank you so much. I'm going to panel and those watching. I've got 2 more questions. Then anybody that wants to speak, feel free, or if you have questions, feel free to ask them. But Dr. Spears, trying to take the politics out of the question here. If a business member,
Sure. I'm not sure any of us can do that, but we'll try.
But yeah, exactly. Just whether it's a citizen, a Pinal County resident, or a business, is the Center for Disease Control website and Dr. Fauci, are they still some of the best reliable sources for people to get information?
Yes.
All right. Well, excellent. Okay. And then Katie,
I was just going to say the lawyer in the bunch would probably say, keep it short. No. So, no, I mean, the CDC has information from across the nation and also looks at information from across the world. So we do look to them for guidance. and they drive much of what the state relies on, which then trickles down as well to the local public health.
Thank you very much. Then, Katie, this question is for you. Would you be able to share, have many of the clients that you work with, have they been attending or mentioned that, hey, I went to the Arizona Commerce Authority boot camp and their videos have been very valuable? Or any comments on that? Because they put out 80 videos now to support businesses.
Yes, so the Arizona Commerce Authority is actually one of our partner organizations. So we work very, very closely with them. A number of our centers have presented as a part of those boot camps. I will be doing so next month. So yes, I have seen most of those. I think that they're very helpful coming from a business counselor's perspective. But also I've shared that resource with all of the clients that I have worked with so far this year, and those who have had the time to view them either live or gone back and viewed them later have found that they were very helpful. So yes, I do think that they are a wonderful resource.
Well, thank you very much. Does anybody have any questions they want to interact with? Now's the time. Or, oh, go ahead, Richard.
And I'm sorry, it's feeding time for my dog. So if they start barking in the background, they're trying to get me up to go feed them. So apologies for that. But I do have a question, and maybe I'm not sure who would answer it, probably Dr. Spears, but I know there's been some discussion about removing the numbers from the Eloy and Florence communities because of the high population and the counts that are being affected. What are your thoughts on that, and or the county's views on that?
It has been the quest of the county to seek removal of those numbers from the positive percentage rates that guide the benchmarks. And when I say remove them, I don't mean that we don't consider those important, because clearly we understand the critical importance of testing inmates, detainees, looking after their health, looking after the well-being of those who also care for all of the inmates and detainees. There has been suggestion that, you know, one of the responses is that correctional officers are coming and going, and so we need to include those rates into our positive rates. And so we have worked diligently to also attempt to separate those as well. We're almost finished doing that, and it would be our position, and we would maintain that that the inmate detainee population is a fixed population, and that the correctional officers, that their data that we're starting to see, which is included in the community data, that we still maintain that it would be helpful to remove that percent positivity out of the percent that's considered with regard to the benchmark data. And maybe we certainly can look at both so that we can see the impact of that. And we can now pull out the information as well related to the officers, and it would be still our position that be removed from our percent positive that affects the businesses as well as the schools. I just want to indicate that our concern is that the testing happened from August to September 3rd. However, it has been indicated that the testing will happen every 2 months. So if in fact that is the case, then in 2 months' time, we may also see a significant change with regard to our data. So the county has made that request And we continue to have those discussions with the state.
Thank you, Dr. Spears. And I suspect I know the answer to this. If those numbers are considered Eloy area, that's another reason the bars might have a tougher time getting started by the percentages.
I just do want to add one thing that I think it's important for people to understand. Pinal, those of us in Pinal County know this, but others may not realize that we do have 12 separate physical locations that report inmate data to the county. And so those include Arizona Department of Corrections, it includes private corrections, it includes ICE federal facilities. So while there may be the appearance that it's a few reporting sources that are through the Arizona Department of Corrections, in fact, we have 12 separate reporting sources. So our county is significantly impacted by that data.
Thank you. I'll turn over to anybody else that would like to continue their discussion or any questions. All right, if that's go ahead.
Yeah, and just a question for Katie or Isabel. What's one thing you have for businesses right now that you can provide or help them get back on track, or even just stay open? I mean, is there one thing? I know it's probably like a silver bullet, but you could share with our business community?
I don't know about one thing. That's difficult, but what I could tell you is that most of the conversations that we're having right now are surrounded around, if they're still open, how do we keep their doors open? So taking a look through their financials, where can we cut cost? How can we increase sales? Are there different markets they can expand into? If they are still closed, then, what funding options are still available to them to keep the wheels running while they're still mandated to be closed. So those are the types of conversations that we're having. So really where we can be of most benefit is having someone come and set up a one-on-one session with us, so we can really dig into their business, figure out what's going on, and figure out how we can help them move forward.
All right, thank you.
I would just add one item. If I could just limit it to one item, I would say business owners, be persistent and seek resources over and over and over. Everybody is so familiar with the PPP, but there were additional resources available. EIDL is still open. That's a direct SBA government assistance loan. There's the Main Street program that a lot of the communities are participating in. The city of Casa Grande offered their own small business grant program. So just be persistent and diligent and don't give up. Keep looking for those resources.
Thank you. Anyone else?
Yeah. Mark, you hear me?
Yeah.
Is Dan Snyder? Okay. An observation more, I think in looking at what I've observed anyway from the business community, I think we have some changing business models that are going to have a far range impact. And if you look at bars, restaurants, gyms, even department stores, you go by the shopping malls, the effect of online shopping is happening to department stores. It's happening even in grocery stores. A lot of those employees are maybe part-time. And so I think that's where we really have a problem now. A lot of people who are working in those bars and restaurants weren't working 40 hours, didn't have benefits. Regular businesses are finding a way to survive, I think. I look at construction, I look at some of that stuff seems to keep going. But it's that, I don't know what, food industry, hospitality industry, sports venues, that's where we seem to have a real hard time getting going again. And those people, I think, are ones that are going to really struggle. And so I think the business model is changing. You know, people are using the internet more and more to buy things, even grocery shopping. People, I live in the retirement community, people are ordering things online, whether it be at Fry's or Walmart, and you just go pick it up, as opposed to going and walking up down the aisle and pick up things maybe they didn't need. Now they're just ordering things that they need. And so that changing business model, I think we have to be aware of it. And as chambers, kind of help some of our members what to do with that change in model. Thank you.
All right, good point. Okay, last call if anybody else wants to comment. I do want to do a shout out to the town historian. Dick Myers is online. So thank you, Dick, for joining us. And Richard, we can probably have this link within 24 hours to our website of the recording. Possibly. All right. All right. Well, panel, thank you so much. And we'll share this. I'm sure we're going to get a few hundred views on this. So thank you so much, and have yourselves a great evening. The chamber really appreciates it. So take care. And Richard, thank you.
Thank you, everyone. Have a good evening.